So recently I found that there's this really strange phenomenon of these limp dick loser cocksucker retards on TikTok faking mental disorders. So to give an idea of what it is when you fake a mental disorder, this is called Munchausen syndrome, I believe. Now I could have butchered it, but I want to sort of talk about what it is. So this is a rare type of mental disorder where a patient fakes illness to gain attention and sympathy. So it's hard to diagnose because there's many other conditions that need to be ruled out first. Now, of course, the treatment aims to manage rather than cure the condition, but unfortunately, this treatment is rarely successful. Munchausen syndrome by proxy, MBP, is the old term for a form of abuse where a person either fakes or produces symptoms in someone else, usually their child. This is now called fabricated or induced illness by carers, or FIIC, and is different to Munchausen syndrome. So, let's talk a little bit about what is Munchausen syndrome. Munchausen syndrome, also known as facetious disorder, is a rare type of mental disorder in which a person fakes an illness. The person may lie about symptoms, make themselves appear sick, or make themselves purposefully unwell. This type of mental disorder is most often seen in young adults and is considered a type of self-harm. A person with Munchausen syndrome can be very convincing, which can result in doctors providing unnecessary treatment such as medication or surgery. A person with Munchausen syndrome doesn't pretend to be ill for personal gain, such as prescription medications or money. Instead, the person is driven to behave the way they do for complex psychological reasons, including a strong desire for attention and sympathy. Often people with Munchausen syndrome have experienced childhood trauma. So the next question, of course, would be, what are some of the symptoms of Munchausen syndrome? Well, a person with Munchausen syndrome gains intense satisfaction from the attention associated with playing the ill patient. Signs and symptoms that may suggest Munchausen syndrome include a spectacular medical history that includes many tests, medical procedures, and operations, an odd collection of seemingly unrelated symptoms, a lack of conclusive results despite intense medical investigations, new symptoms that appear after medical tests prove negative, extensive medical knowledge of many different illnesses, frequently visiting many different doctors, sometimes in other states or territories, frequent presentation at emergency departments, usually at different hospitals, requests for invasive medical procedures or surgeries, failure to improve despite medical treatment, including relapsing for unknown reasons. So now we go on to what are some of the ways that this commonly presents itself. So a person with Munchausen syndrome may convince doctors in many ways. For example, they may pretend to be in pain, exaggerate symptoms, fake symptoms, including psychological symptoms, poison themselves with chemicals, infect themselves with unclean substances, tamper with diagnostic tests, for example, contaminate a urine sample with sugar or blood, interfere with the medical condition so that recovery is impossible, for example, repeatedly open or contaminate a skin wound, or not take prescribed medication. And they may ignore a genuine medical problem until it becomes serious. So, some of the common complications of Munchausen syndrome are as follows. A person with Munchausen syndrome is at risk of many complications, including, but not limited to, side effects from prescription medications, including overdose, complications from poisoning or self-harm practices, complications from medical procedures or surgeries, death from self-harm or complications of medical intervention. Now this of course results in many different risk factors, and some of these risk factors are as follows. Chronic illness during childhood. The person may have received a lot of attention because of their illness. Chronic illness of a significant family member when the person was a child. Self-esteem or identity problems, relationship problems, difficulty distinguishing reality from fantasy, ability to lie and manipulate, a history of mental problems such as depression, hallucinations, or post-traumatic stress disorder, and the need to blame personal failures on external factors such as illness. Now, diagnosing is particularly difficult because there's a range of legitimate physical and mental illnesses that must be ruled out first. To complicate matters further, a person with Munchausen syndrome tends to seek help from various healthcare professionals and providers to avoid tipping off any one doctor. Diagnosis, if it happens at all, may depend on abstract concepts such as the person's symptoms don't make any sense when compared to the test results, the person is unusually eager to undergo invasive medical procedures and operations, the person doesn't respond to treatments in a predictable fashion, and other people in the patient's life don't confirm the person's symptoms. So, treatment for Munchausen syndrome, and this is important to keep in mind, but treatment aims to manage rather than cure the condition. But unfortunately, it is rarely successful. Recovery tends to be slow or non-existent. Treatment options may include medications to treat associated mental health illnesses, such as depression or anxiety. Unfortunately, a person with Munchausen syndrome may misuse prescription drugs to provoke symptoms for further medical intervention. Cognitive behavioral therapy, or CBT, may help to change a person's beliefs and actions. However, it is unlikely that someone with Munchausen syndrome would admit to falsifying symptoms, which can make progress difficult. Some people with Munchausen syndrome flatly refuse psychiatric help. Avoiding unnecessary tests and surgeries is important to reduce the risk of complications. This can be aided by encouraging the person to go to only one primary care doctor. However, a person with Munchausen syndrome is likely to move on to other doctors and start again. So, now, what is Munchausen syndrome by proxy? As we mentioned previously, MBP, Munchausen syndrome by proxy, was a term previously used for a rare but serious form of abuse where a person either fakes or produces symptoms in somebody else, usually their child. In Australia, MBP is now known as fabricated or induced illness by carers, FIIC. To distinguish it from Munchausen syndrome, in Australia, FIIC is considered child or victim abuse, rather than a mental health condition. In cases of FIAC, a carer may deliberately poison or harm a child to procure unnecessary tests and medical procedures. The most common form of abuse appears to be apnea, stopping the breathing. The child may be revived by ambulance drivers or officers and taken to hospital, where all tests prove negative. Sometimes the child doesn't survive the carer-induced apnea. FIAC is very rare, with estimates suggesting that between 15 and 24 cases occur in Australia every year. The mother is the perpetrator in most cases. However, this is thought to reflect the high number of women who take on the role of primary caregiver. So now, there's a few different ways to get help. And of course, your first one is going to be your general practitioner, as well as the Mental Health Foundation of Australia. And you can reach them at 1300 Mental Health Foundation Australia 643-287. You should also contact the Australian Psychological Society at 1-800-333-497. And you should contact your local Child Protection Crisis Line, mental health carers, etc. Now, what I read from was betterhealth.vic.gov.australia. I will provide the article that I read from, and that way you can see for yourself. Hope you all enjoyed, and until next time, do not be like one of these TikTokers, please.